Hi, nurse practitioner, functional nutrition, and fitness coach Nicole here to talk to you about treatment for Postural Tachycardia Syndrome, also known as POTS. Now, as always, these videos are for information purposes only, not meant to diagnose or treat any one person. POTS is a disorder characterized by orthostatic intolerance, which is the ability to stand upright for a prolonged time without symptoms such as dizziness, palpitations, high heart rate. In previous videos, I've covered the signs and symptoms as well as the diagnostic approach to POTS, so now let's get to the treatment. First and foremost, we start with diet and lifestyle. It is only in severe cases or if these methods fail that we then move to medications. Water intake should be at least 3 liters per day for the client with POTS. Salt intake targets goes up to 8 to 12 grams of sodium chloride per day. Now, in contrast, the dietary guidelines for Americans is 2,300 milligrams of sodium per day, which is a little over 2 grams per day, which is about a teaspoon of salt. The goal with these measures is to increase the volume of the fluid within the body to help address that hypovolemic state that is seen with POTS. Exercise is the next most important step, and this addresses the deconditioning that we see with POTS, which is usually exacerbated because these clients don't feel very good when they're up moving around, so they tend to do less activity, which actually worsens their condition. So we want to start out slow and gradual. I recommend under the guidance of your provider and maybe a cardiologist if they're involved with this. They may have come involved just because of the severity of the tachycardia. They needed to check your echo and an EKG and things like that and get cleared by a cardiologist before you do start activity. And then work with a certified personal trainer or a coach who is versed in this type of a diagnosis and the proper protocol. Now, a lot of clients do very well and respond very well to exercise, especially starting out with things that are in the more recumbent position because standing can be a problem, so things like recumbent bike, rower, and swimming. It's also very important that we are addressing muscle strength. So we want to do strength training head to toe, but most especially in the lower body, because this is where our venous return pump really comes into play with those muscles that actually help pump the blood back up the body and help those symptoms of that orthostatic intolerance. So it's recommended to start with 3 to 4 times a week, 30 to 40 minutes per session at 70 to 75% of maximal effort or max heart rate estimate. And there's calculators out there that you can look at to kind of figure out your age bracket where your max heart rate should be. But everyone is different, so just know that that's just a starting point, a guideline. Doesn't necessarily mean that that applies exactly to you. It can take up to 3 months of consistent training to see improvement in symptoms. So don't give up if you don't see improvements within a week or 2. Conditioning takes time. In a study of 103 POTS patients who completed mild to moderate intensity progressive training, 71% went into remission and no longer met the diagnostic criteria for POTS. That's incredible, guys. If a drug were to have an efficacy rate greater than 50%, like remission of 50% of the symptoms that it's targeting, it's called incredibly efficacious, very efficacious, meaning that it works really well. And these are drugs that have side effects. Exercise doesn't really have those side effects. You got no excuse. Other strategies include minimizing bed rest, as this just exacerbates symptoms, managing catastrophizing, which means everything is like a 10. It's not, anxiety, and functional disability with counseling and cognitive behavioral therapy, developing physical habits such as tensing the lower leg muscles and the glutes to help, again, with that venous return, with the muscle pump down there. You can also cross your legs when you're sitting because that actually increases pressure in the lower extremities and helps the blood return. And then moving around when you are standing, rocking from foot to foot, or if you have the option of having like one of those treadmill desks, That's kind of expensive, but if that's a possibility, that would be great. Or just making sure that you take regular breaks to like walk around and move, because the movement is what's going to improve that blood flow. We also want to improve the quality of the sleep, making sure that you have a consistent bedtime and wake time, even on the weekends. There's a thing called social jet lag, and it's real. And thinking that you can make up for poor sleep on the weekends by sleeping in, it's not really a thing. The sleep debt, yes, you can make up some of it, but it takes its toll over time, and you do that over the course of your lifetime, you're just increasing your risk for chronic disease and Alzheimer's. So I don't advise that. You also want to ensure that the bedroom environment promotes sleep, cool, dark, no electronics. No electronics an hour before bed, and your last meal should be 2 hours before bed and no snacking after that. In cases of severe POTS, or if diet and lifestyle interventions are unsuccessful in helping to alleviate symptoms, or at least most of the symptoms, we can also look to other things such as compression clothing, stockings, or abdominal binders that can help with the pressure and venous return. We can also look to some medications such as beta blockers like metoprolol, or vasopressors such as midodrine, which helps with blood pressure, especially low blood pressure. That can also help with these situations of orthostatic intolerance. Each patient is unique and must be evaluated thoroughly for their particular signs and symptoms that are correlated with their POTS in order to come up with a customized treatment approach for them. There is no single algorithm out there for every POTS patient. You must work with a qualified health professional to find the best treatment option for you. In a survey of 502 patients with POTS 5.4 years later, 19% reported complete remission, 51% reported persistent but improved symptoms, and 16% reported intermittent symptoms. While POTS is a chronic condition, it has not been shown to increase mortality or early death. If you found this video helpful, please like, comment on anything that you would like to know more about, and share with anyone who you think would benefit from this information. Follow and subscribe. Be your own advocate and take charge of your health.